Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to be teaching you the 5 top exercises you want to avoid while working out with degenerative disc disease. This will save you from injury, a lot of aggravation, and help you stay fit without hurting yourself. So one of the most common mistakes people make with degenerative disc disease is thinking they can strengthen the abdominals by doing curls like this, okay, or crunches, or doing full sit-ups where they're trying to come up all the way. Unfortunately, that puts a lot of flexion or a forward bending motion in on the discs of the lower back, which actually aggravate them. I have a lot of patients that have been aggravated with that. So what I always tell my patients with degenerative disc disease of the low back is to replace that with what we call the straight leg curl up, okay? As you keep your legs straight, you're going to tuck your tail under, making sure you have any alignments of your body correct. Remember, we don't want to strengthen dysfunction with general exercise. We always want to make your exercise specific and tailor it to your unique body needs. So if you have a tendency to hip hike or raise one hip up slightly when you're crunching or moving, or tilt your ribs to one side or twist, you want to engage your body and correct all those so you're thinking about your body positional corrections and alignments as you're doing these exercises. If you're not sure about your own unique body posture and biomechanics, I would suggest going to the Pain Free and Fit or PostureSize.com websites and learning about your unique situation. So we're going to keep the legs straight and emphasize tailbone under as we hold our own unique alignments, okay, in proper position, and then sit up by using the bottom of our rib cage moving towards our pubic bone. It's a very slight motion. And as you hold this, you'll notice your abs really tightening. It's a great abdominal way to strengthen and tone the abs without irritating the lower back. Again, it's tailbone under, which flattens the back, pubic bone up, and then I sit up from my ribs, not leading with my head, which is the mistake with most abdominal crunches, but leading with the bottom of my ribs and allowing my head and torso to follow. One of the other problems that people have with abdominal training degenerative disc problems is they perform leg raises, either lying face up or hanging from a chinning bar or a dip station using both legs. Now the idea behind this is it's a great abdominal strengthening exercise because it tenses the abs, but in reality it's mainly training the hip flexor muscles. The abs are recruited to stabilize the spine, but unfortunately most people don't stabilize the spine. If you feel their spines while they're doing leg raises, there's movement going throughout it. So I much prefer an exercise known as hip flexion with rearward tension or motion of the thigh bone and the hip socket. So what we're going to do with that is, from a position of alignment and correct stability, we're going to hold the tail under to flatten the back within your comfort levels. In other words, if you put your tail under too far, you feel back pain, you want to just put it under a little bit. And then you're going to think about the side of your hip. There's going to be a bone on the side there, the hardest bone. That's your greater trochanter. It's the side of your leg bone, right where it hooks into your hip socket. You're going to put one finger behind that bone. That bone is like the size of a golf ball. It's the most prominent portion of the side of your hip. And one finger on the front of that bone. And what I want you to do is, as you hold the tail under, think about moving that bone downwards into your lower finger as you bend your knee. And this is important for a lot of people with degenerative disc diseases because most people with problems in the lower back, including degenerative discs, have a weak glute muscle or buttock muscle. So by tensing the leg down in the hip socket, it recruits or wakes up that buttock muscle. That's what's actually attaching to that bone and bringing it down. And you'll feel that bone moving away from your top finger and into your bottom finger. And that's a great exercise to retrain proper hip flexion. Make sure you're not externally rotating your leg or turning it out or in. The leg should be straight as you're doing that. And if you feel that bone moving up into your upper finger, you need more buttock contraction to bring that bone back into the lower finger. And as you do that back and forth, you're training your hip flexors correctly while stabilizing your lower back. Another very common problem people make is training with curls for the upper arms. As you're training curls, whether you're using dumbbells or a bar, there's a tendency to use momentum and extend the spine, especially the lower back, to get the weight up. And I can't tell you how many of my patients that work out in the gym wind up hurting their degenerative discs with this motion. So a great alternative to that is to use a spider curl, which is to lay all the way back on a flat bench, let your elbows fall down behind you, holding like dumbbells, and curling up towards the armpits. As you do this, the spine is stable, and you're really localizing the pressure to the biceps. This is sometimes stressful on shoulder joints, so what I would suggest is as you bring your arms back, only bring your elbows back as far as is comfortable, and emphasize a backwards tension of that arm bone in the socket, just like we were doing in the hip a moment ago. Pushing down, we want to tense that shoulder down in the socket to spare the shoulder as we're curling. A lot less load on the lower back, great upper body workout. A lot of people also have a problem with squats. Regular barbell squats, where you're going across the back and squatting down, okay, or deadlifts or even dumbbell squats, load those degenerative discs in the back. They're compressing it, and that many times causes injury. So what I tell my patients to do in the gym, if they still want a great heavy leg workout, is to use a bar across the thighs, okay, and as they hold their core, lower tummy in, pressure bulging out at the multifidi muscles in the lower back. If you're not sure about that, we have a separate video on that, or at the Pain Free and Fit website we explain that. And as the weight is being held against the thighs, we're going to squat up and down. Now here, there's very little load in my lower back because my thighs are taking the load of the bar, and I'm simply keeping my hands on the bar. You can do this in a squat rack or a deadlift rack or a power station, so that as you're going to the bottom, if you get stuck, you can just release the weight and it'll be held. But a great workout, again, you're emphasizing buttock contraction with squatting, not trying to lift the chest up first, but squeezing the buttock, raising the pelvis, driving the force through the bar as you do so. Another option is to do lunges or split stance squats, where we have one leg back, the bar going across our thigh is now putting pressure down in our thigh through our hip. The lower back is spared of any compression, and you notice my back is pretty much straight up, even less stress on the back than the squat. Okay, what you're not seeing from there, let me show you from this view, is making sure that we're not hip hiking or swinging that front hip up, but keeping it down as we go up and down. Okay? And the last thing I find with a lot of people is with overhead presses, okay, whether you're doing dumbbell presses or bar presses overhead, that's a great way to put a lot of axial compression on degenerative discs in the back and aggravate them. So what I like to do is I like to use a modified exercise where we can either press unilaterally, one side at a time. You can still use heavy weight, but it's a lot less stressful on the spine because you're only loading one side of the body. Or even better, using a side press technique for shoulders. Okay, this is also good for a lot of my patients with shoulder problems, where you're pressing straight up. Great shoulder workout. Spine is in a neutral, safe position as we go. So use these 5 tips as you're exercising, as you're putting your fitness routine together. Stay out of stress to your degenerative discs, and I'm sure you'll be in a lot less pain. Again, if you like this, what we're doing on these videos with these exercises, please leave us a comment underneath to join our channel. There's a lot more exercises you can learn without hurting yourself. You can get pain-free and fit. Enjoy.